Wondering how to perform a Bier Block for your patient? You've landed at the right spot. This tutorial is all about guiding you through the steps of the Bier Block, a trusted regional anesthesia technique that has been easing pain for over 100 years. Let's get started with a general introduction. The Bier Block, credited to August Bier, the German surgeon who initially brought it to light in the late 19th, is a variant of intravenous regional anesthesia. It's mainly used for arm and hand surgeries, boasting the benefits of swift onset, potent anesthesia, and quick recovery. The first step in performing a Bier Block is to prepare the patient, explain the procedure, obtain informed consent, and ensure the patient is comfortable. Next, position the patient's arm in a manner that it's comfortably extended and apply a standard blood pressure cuff around the upper arm. The second step involves the insertion of an intravenous cannula. It's usually placed in the back of the hand or the lower part of the forearm. Remember, it's essential to confirm the correct placement of the cannula by checking for a good blood return. The third step is the inflation of the blood pressure cuff. Inflate it to a pressure above the patient's systolic blood pressure, usually between 250 to 300 millimeters of mercury. This is done to ensure that the local anesthetic remains within the desired area. Next, you introduce the anesthetic. Inject a local anesthetic, often lidocaine, into the cannula. The patient may feel a warm sensation as the anesthetic travels up the arm. Once the anesthetic has been administered, you will need to wait for it to take effect. This usually takes about 15 to 20 minutes. During this time, the inflated blood pressure cuff remains in place, trapping the anesthetic in the desired region of the arm. After the anesthetic has taken effect, the procedure can begin. The cuff remains inflated throughout the procedure, ensuring the anesthetic stays in the operative area. When the procedure is complete, the blood pressure cuff is slowly deflated. This allows the anesthetic to be gradually released and absorbed into the patient's system. In summary, the Bier Block offers a reliable and effective method of providing regional anesthesia for surgeries on the arms and hands. The process involves preparing the patient, positioning and applying a blood pressure cuff, inserting an intravenous cannula, introducing the anesthetic, waiting for the anesthetic to take effect, performing the procedure, and finally, slowly deflating the cuff. Remember, as with any medical procedure, the Bier Block requires careful attention to detail, a thorough understanding of the technique, and a commitment to patient safety. So, there you have it, the step-by-step process of performing a Bier Block. This technique, steeped in history and proven by time, continues to be a valuable tool in our anesthetic arsenal.